name is Uwe Diegel and we're here at the Protos Blockchain Summit in Switzerland, and it's really cool and the weather's beautiful.
Cool. So what are your impressions from the conference so far?
Well, so far it's only just started, so everybody's still talking about the worldwide obsession on security and safety and data. And this is basically one of the main reasons why we started the healthbank project, because we have a semantic problem in Europe right now in terms of data utilization, is that everybody's busy shaking the ghost of data safety. What I mean by that is, if I ask you, Luke, are you afraid, Luke, that I'll take your medical data and I'll sell it to the insurance companies to make you pay more money? Then you say, of course I'm scared. But if I ask you the same question by saying, Luke, would you accept to share your anonymous blood pressure data with the Heart Foundation? Then you say yes. The problem is that in the last 25 years of medical work that I've done, I've never once met a patient who wasn't prepared to share his data, as long as he knows why he's sharing it. But right now, everybody again is shaking this ghost of data safety, and the problems with Cambridge Analytics and Facebook don't help because it creates this impression of unsafe usage of data. Mm-hmm. Basically, most people think of Google, they think of it as an actual person behind a screen rubbing his hands saying, haha, look what I'm going to do with Luke's data. And so it's created this incredible misunderstanding of the value of data. Most people think that their own individual data is worth a lot of money. I got an answer this morning, $1 million is the value of my data. But the actual value of an individual's data is a very disappointing $1.67.
So maybe, Uwe, could you tell us what's coming up in terms of the product development? What can we expect?
Of course. Right now, up to now, we've been focused on collecting data. So today we have about 267,000 users. But again, collecting data is just one part. Having data is one thing, using the data is the next. So what we've developed now is we're starting to develop what I like to call the key of life, a way, in fact, for people to understand their data so they can use it better. It all started in 2008 when, in fact, healthcare started going digital. Previously, if you had a medical file, it would be hundreds of pages of paper, so that if you were lucky, the doctor looked at the first top 5 pages. Then we said, oh, we're going to go digital. So we took those papers and we put them in hundreds of pages of digital lines. So again, if you were lucky, the doctor clicked on the first 5 lines, so it didn't really make much of a difference. There was a man called Edward Tufte, who in 1907, I think, published a book called The Visual Display of Quantitative Information, and how, in fact, you can show information that people can understand immediately. And the whole idea of the key of life is to, in fact, instead of having a medical file which consists of hundreds of lines, is to have your date of birth. When are you born, Luke?
82.
So you're born in 1982. Today we're in 2019. So you see the date of birth, and suddenly maybe let's imagine that in 2012 the line changes color and becomes blue, which indicates a change of state. So you can open it and you can see, oh, well, in 2002 Luke became diabetic or whatever it is. I'm not saying you have diabetes. The whole idea is we want people to really instantly understand the entire, or see the entire medical file. So this is what we're preparing right now. Not just a way for people to upload their data, but also a way to visualize their data.
And when can the customers will be able to see some sort of demo, or how they can?
Well, right now, the
interact?
demo they can already see, but in fact now putting it in practice is another thing. So right now I'm basically programming and spending maybe in about 2 or 3 months we will have a full-on working system for people to be able to visualize their data. And right now all they can do is they can see their data and share their data, but we really want people to understand their data. And again, that's what HealthBank is about.
And is the data secure on HealthBank platform, and how?
Well, of course, I mean, now, we have these magic words in our industry, which are blockchain and artificial intelligence. For me, security is a given. And security is all about transparency, to be able to see where your data has been and where it's going to go. And so, of course, everything is blockchain protected. So far, there has not been anything better than blockchain, but as technology progresses, we will add it on. So yes, right now it's completely secure. But even re-emphasize that security is not the main aim of a health base. The question is, what is the interest? I mean, again, I come back to the fact that data is only valuable if it is used. So if it is used, people want to see how it's been used and where it has been used. But right now, we are probably the most secure platform that there is.
Perfect. Thank you.